Hi. So we're just going to get started in a few minutes. Great to see everybody again. I'm on Facebook and Instagram again. So we're into, I've kind of lost count of where we are with the lockdown. It seems to be just dragging on now and no sight of us going back to work. But today and for the next sort of week and into next week, I'm really going to focus on the implant dentist that's early on in their career and sort of give tips and tricks and highlights areas that I feel that are crucial to develop on, etc. So really focus on that aspect, and also on the dentist that wants to start getting into implants. So over the next week and the week following, that's what I'm going to be focusing on. I'm going to try to go live every single day just for 10-15 minutes and go over some tips. If there's anything that you want me to cover, drop me a message, email. Honestly, I'm always looking for topics to cover. So you remember I sort of focused last week on my Facebook Live, and I talked about some recommendations if you're a dentist looking to get into implant dentistry, and I talked about mentoring, identifying a course, thinking about building a brand for yourself and developing a niche, having support within the practice environment that you're working in. Also to focus on setting yourself goals, and important that although you've been on a course, how you're going to get those numbers to build up your experience. So that was sort of my sort of 5 tips to sort of getting started in implant dentistry. So I'm on Facebook Live and Instagram Live, and happy to take questions. I'm going to focus on starting your implant journey, and if you're a dentist looking to get into implants, what you should be doing. But today's topic of discussion is my top 10 tips on achieving success within surgical dentistry. So I used to do a lot of oral surgery before I then went into implant dentistry, and it was a natural progression. And I do some study days in oral surgery, and I have done in the past, and I give this lecture that highlights my top 10 tips, and today that's what I plan to do, is share my top 10 tips in surgical dentistry. So I'll just give it another minute or two. Hi Alistair, thank you for all the nice comments. Hi Mohsen, great to see everyone on. If you have any questions about starting your dental implant journey, then please drop me a message. Happy to take questions. If you want to go on to Instagram and join in a conversation with me and ask me on Instagram live, then press that button to come into a conversation with me, and I'll add you in and we can have that conversation. So really there's 10 things that I talk about that I feel are crucial to develop and be successful within surgical dentistry. And so that's not just oral surgery, but it's also implant dentistry. I think these points are really crucial. So first of all, you have to work within your own level of competence. Know what your limits are, know what you're capable of, know what training you've had, what you've been mentored of, what your mentors told you is suitable for you to work unsupervised carrying out. So that's really important. Always work within your competence. If you're not aware of what you're doing, if you're not sure about it, don't do it. Don't just practice it because you saw someone doing it on Facebook or you've read a book. Have appropriate training, otherwise you will run into problems. You might get lucky the first time, but you will inevitably run into problems. Point number 2 is a really good habit that I learned early on. When you're doing any kind of surgical dentistry, it's really useful to write things out. So write every step out, and then thanks, Homan, thanks for the kind comment saying that I've got a great accent. I'm a big fan of your dental implant work and your textbook. Homan Zarakic is authored in a fantastic textbook which I have here. If you're still on, Homan, here it is. Homan is a very skilled zygomatic surgeon, and he's tuning in live on Facebook. And this is a fantastic textbook that I recommend on full arch implant dentistry. And he said something nice. He says he likes my accent, so I thought I'd big him up. Okay, so the second point is, write down and write down every step when you're doing a surgical procedure. So if we say a wisdom tooth, break it down into what you're doing, from the local anaesthetic, how long you're going to let the local work for, your incision, exactly what your incision design is, draw it out, and then how you're going to raise the flap and what instruments you're going to use. So break down every single step, and it really does. If you start doing that for every procedure, and then write it down, and even have it with you in your dental surgery on the wall, obviously behind the patient, not in front of the patient, that you're looking at a manual, but behind the patient, then I think over time it's a really useful trick and skill to get into, is writing the procedure down and visualising the procedure, and then over time you won't need that bit of paper. So that would be my second tip. The third tip is teamwork. We can't do what we do without the team support within our dental practices, and a teamwork within fellow clinicians that we work with. So it's so important to have a good team, and and build trust within your team. For instance, if I take the example, the value of a good nurse is just absolutely crucial, that your nurse knows exactly what you're doing. So talk to your nurse about exactly what you're doing for your procedure, what you need her to do, how you'd like her to react, the importance that she creates a good field for you to visualise and see exactly what you need to see within the surgical field, that she knows exactly where she needs to be with the aspirator. And it takes time to build that trust and that teamwork. But it needs to be worked on and develop on it and reflect on it after each procedure. Potentially, if you're starting with a new member of staff, talk to your nurse and say, during the procedure, I liked what you did there. I need you to do this. It was really difficult, and I need you to retract more. And my nurse that I used to work with, Claire, is tuning in, and she was wonderful, and genuinely made my job so much easier. And so really, really important teamwork and working with a good nurse. And it's not just your nurse. It's the admin staff of the practice. They need to know what you do in your surgery, because patients can often phone back after a couple of days, and you don't want your admin staff giving a contradictory advice to the patient. So it's a whole team approach, and it's so important within surgical dentistry that you take that team approach. Next on is the surgical equipment you use. It's important to have the right tools. How can you expect to do a procedure if you don't have the right tools available? So understand the surgical equipment you require, make sure it's of good quality, and certainly surgical equipment makes the whole process of the surgery so much easier if you have the right equipment available. So, invest in the surgical equipment you use, and then it certainly makes the procedure so much easier. So many times I travel a lot doing implant surgery in various practices, and I always like to carry my own kit, because I just don't trust the surgical equipment that I'm going to get when I visit practice to practice. I know if I carry the equipment with myself, with me all the time, I know that there's no instruments that are going to be missing, and it's high quality. Then I think that tip number 5 is the single most important change I made early on in my career as a surgical dentist that really changed everything, and that was magnification and a good light. So magnification and a light changed everything for me when it came to surgical dentistry. Suddenly I could just see more. The light was where I wanted it, because I had a headlight, and it was just magnified. And certainly I would say anybody looking to develop in oral surgery skills, surgical dentistry, and then moving on to some implant work, loops and a light is something that's a must-have. And I would recommend a 2.5 magnification for surgical dentistry. Well, a little aside from that is, as I've developed from my surgical dentistry, doing a lot of oral surgery work, onto only doing implant work, I've found that I use my loops and light less, because certainly when I do implant work, I need a wide field of view. So that's what I would say with a magnification, great for surgical dentistry. And then moving on, point number 6, understanding the importance of a flap design and awareness of associated anatomy. So, flap design and appropriate flap design is a real skill, and it takes time to develop it, and raising a clean flap is crucial. So, first of all, what I would say about flap design, it doesn't matter if you do a flap this size or this size, they take the same length of time to heal. So, if you need a big flap, raise a big flap, because all it does is aids your visualization. You want access and you want to be able to see what you're doing. It's so important. But people are always reluctant. Maybe it's because they just don't feel comfortable raising a big flap, and maybe not comfortable then suturing back together. But it's important to start developing these skills. So it doesn't matter if you raise a flap this size or this size, it takes the same amount of time to heal. It's something you really have to work on, thinking about the design, because it can have repercussions if you do not design your flap appropriately. It can lead to scarring, and when patients have a high smile line like this, that you can leave them with nasty scarring. So it's important that you're able to raise the flap cleanly and then put it back together neatly. And also, raising a clean flap minimises trauma. So if you minimise trauma, they get a better post-operative healing. It reduces bleeding if you raise a nice clean flap. And if you reduce bleeding, then your local anaesthetic will last longer. So these are all really important points to note when it comes to flap design. And then that awareness of the anatomy that you're working in is crucial. If you're working in the lower mandible, you need to know where the mental nerve is. And what you don't want to be doing is making an incision through the nerve, because you will cause damage, and you need to be aware of these things. So understand the anatomy in the region that you're working in. Then I'd go on to the importance of local anaesthetic, giving adequate and appropriate and an effective local anaesthetic. And maybe, I always say this to colleagues, if you're keen to get into surgical dentistry, it's really useful to get into sedation and start learning how to do sedation, because I feel surgical dentistry and sedation really go hand in hand, and it works really well if you're able to give a patient sedation as well as effective local anaesthetic. And the best tip I can give in terms of for local anaesthetic to be effective is think about exactly where you're injecting into the patient's mucosa, and utilise local anaesthetic as an aid to make flap raising easier. So you can use a short needle and put it right against the bone and inject the local anaesthetic, and you can get an effect called hydrodissection, where you're injecting the fluid below the periosteum, and that raises the periosteum above and makes you raising of the flap so much easier. Also, a really key point with local anaesthetic, give it time to work. So important to give local anaesthetic time to work. When I do big implant cases, we will administer local anaesthetic, and then we will leave the room for 10 minutes. And I found 10 minutes is a good amount of time for the anaesthetic to become really effective, and then you really get good long-lasting effects with local anaesthetic. Next, moving along, imaging. Whenever we take out teeth, always have an image available. So it doesn't matter what the tooth is like, I always, for medical legal reasons, always have a radiograph. And more and so with the advent of 3D imaging, CBCT scans, and they're so readily available. If you don't have one in your own clinic, they are available in referral basis. For wisdom teeth that are close to the nerve, I do a lot of scanning, and in the past when I used to take out a lot of deeply impacted teeth, they give so much information. So yeah, always think about the imaging that you have available, and an X-ray is absolutely crucial for the tooth that you're taking out. And then if you're taking out complex teeth, as you develop your skill level, think about 3D imaging. And more I found as I did impacted teeth and wisdom teeth, I found myself taking more and more 3D scans. And then what I would say is, as you get into implant dentistry, then I take a CBCT scan for every patient that I place an implant in. Then second last, penultimate point is consent. Really, really important to get appropriate consent and make sure the patient's well informed about the risks and the treatment that you're planning to undertake. For all extractions I always do a written consent, especially more so, and it's emphasised more when I do wisdom teeth extractions. Obviously, risk of inferior dental nerve injury, temporary or permanent. So I can't reiterate that enough. Consent process, especially in the UK with litigation as it is, it's really, really crucial that you get I do recommend a written consent. So I have a consent form, and I'm happy to share it if you so wish. And then finally, post-operative instructions. You can do the best surgery in the world, but if you've not appropriately informed the patient what you require them to do in terms of care instructions, then they could ruin everything. So if we take the extraction, I'm really strict with dental extraction in terms of the dietary advice, the mouth care advice I give the patient, and then that really becomes more crucial when you start doing more complex work, such as bone graft and larger implant cases. The post-operative care instructions you give to the patient are absolutely crucial. So that's what I would say is think about those post-operative instructions. We have a tendency, we've done the procedure and we're like, oh, thank God that tooth's out. We don't sit down with the patient and go through the post-operative instructions and highlight the importance of the post-operative care instructions to the patient. So I would echo that, and my instructions are really, really meticulous and strict. For instance, I encourage the patients, they're not allowed to rinse at all, nothing, no antiseptic mouthwash, no warm water, salt, nothing like that for the first week after an extraction, because I don't want them dislodging the blood clot that's developing within the extraction site. I don't, I tell them to stick to a strict soft diet, and when I do sort of more complex cases, including bone grafting and dental implants, then I'm really super strict, and I tell them they're not allowed to brush their teeth at all. No mouthwash, no brushing of the teeth. Really strict non-chew diet. But it's not enough to give patients verbal instructions. You do need to write these instructions down, so they have something to then sort of go back on and look at, because they won't remember if you just give them verbal instructions. So that's my sort of 10 tips in terms of surgical dentistry and points that I think are really beneficial. I'm just going to quickly recap them for you. So know your level of competence and work within that area. If you want to build, then get appropriate training to then upskill. Write down and visualize treatments that you plan to carry out. Teamwork and the importance. You can't be doing surgical dentistry, complex surgical dentistry on your own. You need team support. That's just not your nurse. That's within the whole practice. So think about that. Think about the surgical equipment that you have available to you. And if you're peripatetic like myself, I carry my own kit around me, so I know I've got the instruments that I like to use. As I said, magnification and a light was a single most important thing that changed my surgical dentistry, and I encourage, if that's what you want to get into, then consider getting loupes and a light, and a 2.5 magnification is what I'd recommend. Think about flap design and the importance of flap design, and the importance that raising a good size flap to aid access and visualization, and be aware of the anatomy in the region that you're working in. Think about your local anesthetic technique, and if surgical dentistry and implant dentistry is something you want to get into, then certainly think about learning and upskilling within sedation dentistry, because I think those two tools really go hand in hand and work really well. Imaging, really important. Understand what to look for in CBCT, and utilise 3D imaging, because they give a wealth of information. And I think an X-ray is essential, a radiograph is essential for any extraction. And then importance of consent, and finally, you've carried out the surgery to the best of your ability, but don't forget about the importance of post-operative instructions. So I'm going to take questions. There are a few questions coming through, and happy to take them. So if anybody has questions, please ask. Happy to take any questions you wish. Thank you for your kind comments. I had a question here. Let me just get to it. Some procedural videos, pics of your flap design raising, including exposure would be great if possible. Yeah, Mohammed, difficult on live events, but yeah, happy to share them. No problem at all. And then, could you post your post-operative? Yeah, happy, Omara. I'll share my post-operative instructions, no problem. I'll go to Instagram. So I'll just recap the plan over the next week and the following week is to look at a sort of focus on the dentist that wants to get into implants and the implant dentist early on in the career, and I hope to get you tips and tricks that will hopefully help in that career and starting off in implants and getting better within surgical dentistry. Thank you for all your comments. I'm going to now leave it. There's nothing else I want to say. I think I've answered all the questions. If you need to get a hold of me, I'm on Instagram, Facebook and YouTube, and I will upload this video onto YouTube later on, so it's always there for anybody who wants to view it. Thanks, stay safe and take care.